With 35 cases of coronavirus in Florida, we understand so many of you have questions and concerns.
So our Angela Rozier is joined by a local doctor to help answer some of those questions right now. Ange?
That's right. Today, we're joining live is Dr. Kitonga Kiminyo. He's an infectious disease specialist here in Palm Beach County. And thank you so much for joining us tonight.
You're welcome.
I want to get right to the questions. We have so many questions for you. Now, our first question is from Stephen, and his question tonight is, please give detailed description of the progression of the COVID-19 virus that has been observed so far as it relates to people who have died, and how long from the time they notice symptoms, how soon did they have to be hospitalized, and what kind of pain, suffering did they have to endure, and how long till they died after being diagnosed with COVID-19. I know it's a lot, but...
Goodness. Good questions. Well, we know that the coronavirus is essentially a respiratory virus, and which is why we tell people, when they're ill, to watch out for respiratory symptoms. And our biggest information is coming out of the patients we saw in China. And basically, those that did pass away are patients who unfortunately developed acute respiratory distress syndrome, or ARDS. And this is basically an acute lung injury, lung inflammation, and then a lot of those patients had complications with bacterial infections. And so a lot of those patients who also unfortunately had comorbid conditions like diabetes and other underlying lung conditions, those were the patients that unfortunately did not do well. And those are the patients that unfortunately within 2 weeks of being diagnosed were on the ventilator, and then a lot of those subsequently died.
Thank you very much. Yeah. Now to our second question right now. This question is from Corvin, and his question is, can somebody please explain clearly and fully in detail what self-quarantine means, including contact with and exposure of relatives and friends?
Correct. So self-quarantine is basically self-isolation, right? And it basically means that if there's a suspicion that that person has been exposed directly or indirectly to someone with COVID-19, we want them to stay home, stay put, and we want you to do that for at least 14 days if possible, given what we discussed about the incubation period. And if they do well, then that's it.
That's something very important, though, to remind it.
Correct.
Thank you so much. Now, we will be on our Facebook Live, WPBF, just a few minutes ago. He'll be here to answer any more questions, and then we'll be back here on live to answer additional questions here at 5:45. Mike?